Welcome to our Q&A. This is our third one, and I got an amazing outpouring of questions, and so I am working through those. And today is no different. We have a great list of questions. All right, so let me get started. Question number one is, I am 18 weeks pregnant. What are the best things I can do to prepare my pelvic floor for labor and delivery? So this is a great question. I love being prepared for everything. I'm one of those planners in life, and so pregnancy was no different. It was like every T and every I that I could dot. And so I just love it when women are taking care of themselves. So a couple of things that I would like you to think about is a lot of the advice centered that you get when you're in your doctor's or midwife office is do your kegels, do your pelvic floor contractions. But there's another side of that. So strengthening the pelvic floor is amazing for helping to support your pelvic organs, helping to support your bladder, helping to support your uterus. So you need good pelvic support. And when you come out of this whole labor and delivery process, I would love for you to have incredibly strong pelvic floor muscles to come out of that with. So doing some pelvic floor contractions could be a great idea. But on the other side of that, as you work on preparing for labor and delivery, I want you to think about relaxing your pelvic floor muscles. So being able to relax them is what helps them lengthen. So the pelvic floor really just needs to get out of the way to allow the uterus to do its job to have your baby. And so if your pelvic floor muscles are super tense all the time because you went for your walk and all you did was hold your pelvic floor tight the whole time, and the pelvic floor muscles don't know how to lengthen and relax, then that can be a problem when it comes to delivery. And so what I want you to work on is feeling your pelvic floor and feeling your inhales, which can be very difficult when you're pregnant. But feeling that inhale go down, feeling that pelvic floor musculature lengthen on that inhale can be really good for helping you prepare. If you feel like you do have some pelvic floor tightness, then seeing an in-person pelvic floor PT prior to delivery can be really good for helping to get your pelvic floor ready for delivery. We also have a birth prep section within our membership that has been completed by Anna. She is our Swiss pelvic floor PT, and she does a lot of work helping women prepare for labor. So she is amazing, and her part in the program is absolutely incredible. So highly recommend checking that out. Question number two is my QLs, quadratus lumborum. So your quadratus lumborum is a broad flat muscle that sits on your back that attaches from your ribs down to your pelvis. So it's a big stabilizer. All right, so my QLs, more so left side, gets tight, obviously overactive, so easily, along with my hips and hip flexors. What am I doing wrong? Okay, so for this question, the QL moves the pelvis. Okay, so if your QL is tight, it's going to be sending your pelvis forward, which is then going to make the hip flexors obviously more tight, hips a little angry. All right, so what you've got to look at is why is that QL tightening up? Okay, so I wrote a couple notes here. The biggest issue that you're going to get into with this is usually when people come in with something that is tight, I like to see them move. So I'm not sure exactly where you're going wrong without seeing you move. I need to see your body move through exercises to be like, oh, that's it. That's what's happening. You know, your right external oblique isn't kicking in quite enough, and that's making that side of your back, your QL, have to overwork. Or maybe you are going into an excessive anterior tilt every time you hip hinge. I don't know. I need to see you. So that is one of the reasons why we do a lot of video exercise analysis within the program to help women, because it's really hard to give somebody advice if you're not watching them move, because specific recommendations need to be made based on how you are moving, and everybody's body moves a little differently, which is why there's no such thing as cookie cutter approach to stuff working well. All right, so I have a coaching video where I'm working a patient through doing a half kneeling rotation for obliques. Okay, she's a diastasis patient. I am going to link that video for you. I want you to check it out, okay? So there's a lot of tips on there, like when she hikes her hip up, when she side bends, where I can say, nope, your back is cheating. I want you to focus more on the front. And so what I want you to do is pay attention to what's working when you do that exercise. Are you getting obliques? Are you getting abdominal control, or are you going to your QL for that exercise? So that is a really good telling one that I would love for you to do. So I'm gonna link that for you, so be sure to check it out and be sure to check out those coaching tips, and then use that as your starting point to kind of figure out, okay, what is substituting? Why is my QL kicking in? I think that would be a good place to start. Okay, question number 3 is, I have mild to moderate prolapse. I am almost 2 years postpartum. I just saw my gynecologist who wants to send me for corrective surgery. Is this a good idea? Oh, that's a hard question. I have heard mixed things. My body is significantly stronger than it was immediately postpartum. I've been working on kegels on and off and have noticed strength improvement, but still not very strong. I have trouble fitting in daily workouts, and ideally would like a 15-minute daily whole body strengthening routine that's prolapse safe. Does that exist? I like it that you added that does that exist at the end. Okay, so I'm gonna break this question down into parts because it has so much going on that I think it's important to address all of those pieces. I am not anti-surgery, okay? I just wanna make that very, very clear. Sometimes corrective surgery, pelvic floor corrective surgery, is the best answer. And sometimes it's not. So I'm not just a go for it, free for all type person, I guess is what I am. There are sometimes where I think surgery is a very bad idea. The risks do not outweigh the benefit, and that is what you are looking at. Do the risk outweigh the benefit? The biggest cause of failure rates with surgery is pelvic floor strength. So women who had less than a 3 out of 5 strength of their pelvic floor contraction were more likely to see a failure of the surgery. You don't want to go through major surgery like that just to have it fail, okay? So all I'm saying is that sometimes surgery is the best option and sometimes it is the worst option. And sometimes we rush into it a little bit too soon, and I would love to see women do a lot more work. All right, so the better you are, the stronger you are, the more connected with you are with pressure management so that you can tell when you're bearing down, what's happening with your pressure system, what's going on with your abs and pelvic floor. So the better you are with that, the better outcome you're gonna have for surgery. So it's like a win-win. Doing rehab before having any type of pelvic floor surgery is such a win-win because you might fully resolve your issue, or you might resolve your issue to the point where you're like, oh, I can live with this. This is not bad. This does not affect my life. I know a lot of women that have a grade 1 or a grade 2 prolapse that it does not affect them one iota. They run, they jump, they do Olympic lifting, they do CrossFit, they do whatever they want, and their prolapse is not even a thought and not even an issue because they have gotten to that point. So just because you have a low level prolapse, it does not mean you have to have surgery for that, okay? So I'm just putting that out there as well. The other thing to keep in mind is if you're having surgery for pain for your prolapse doesn't often, mild to moderate prolapse doesn't often cause pain, okay? Now moderate to severe prolapse is a different story, and that's not what we're talking about here. We are talking about mild to moderate prolapse. Oftentimes pelvic floor tightness can be confused with something that the prolapse might be causing. So I've seen a lot of women that have prolapse surgery and then they still have the same exact pain after surgery. Okay, so if you are experiencing pelvic floor pain, make sure you go see a pelvic floor PT to get looked at to see if you have pelvic floor tightness and see if that is what's causing your pain before you rush into surgery. If you do not like your pelvic floor PT, go see another one, okay? It's like shop around, okay? Find somebody who's a good fit. It's not, one size does not fit all, and one pelvic floor PT does not know everything. Me included, as far as the PT realm goes, we all have our different subsets of experience. So you could get vastly different opinions. The same thing goes for surgeons and doctors. You might see another surgeon who's like, oh, I'm not gonna operate on you until you're, well, in the menopause, and let's see if this gets worse. So you just never know. So I love getting multiple opinions. I feel like that is always in our benefit, a little bit harder right now due to the times. But I do feel like that is well within our benefit. Okay, back to my notes. All right, so a couple things there, just unpacking that. Make sure that the reason you're going into surgery is not one that is fixable with physical therapy and not one that surgery won't touch, like pelvic floor pain, depending on what's causing the pain. So make sure you understand that. Oftentimes you say that you've worked on kegels, but you're not getting stronger. So that often has to do with what's going on with our hips. Where's your hip sit in the socket? How is your internal external rotation? What's going on with how the hip is moving? All right, so there's a study looking at people that had osteoarthritis and needed hip replacements. And when they got their hip replacement, their pelvic floor improved without doing anything for the pelvic floor. Okay, so their hip was causing their pelvic floor issue. I have seen this time and time again with people that go, even get biofeedback, doing kegels and kegels and kegels, and they're trying to strengthen their pelvic floor, and their pelvic floor just won't get stronger, and we look at their hip or their foot and arch and how their foot and arch is controlling their hip, and then their pelvic floor improves. Okay, so all I'm saying is that go get more opinions, okay? Surgery might be the best answer for you, and surgery is often a great answer for many women, but I just wanna make sure that you've crossed all those T's before you get to that point, because it is not without risk. All right, the other thing I want to talk to you about is this 15-minute workout. You are such the optimist. I love it. All right, so there's a big difference between maintenance and gaining strength. I don't see in any world where you can reach major fitness goals and rehab goals, like what I would need to see somebody go through to improve prolapse, in 15 minutes a day. I just don't see how that's possible. Now, once you get in great shape, you might be able to maintain, because maintenance is a whole different animal than strengthening. So it's like you've got to walk to the top of the mountain, and then the top of the mountain is a nice plateau. On a nice plateau, 15 minutes a day, if you're doing like really fast, one thing to the next, know exactly what you're doing, know exactly what you're working, doing lots of compound body movement, so you're hitting lots of muscle groups at once, you might be able to maintain. And especially if you're kind of sprinkling things in throughout your day. So exercise is just kind of part of your living. Like you're, standing with kids and you're working on arch strength. Maybe you're doing some calf raises, so you hit that while you're, brushing your teeth. So you've got a lot of habit stacking going on throughout your day. But 15 minutes a day for covering rehab, for helping to improve prolapse, and even getting in some semblance of shape, because I find women who don't have strong upper body strength end up bearing down more, making their prolapse worse when they try to lift something, because just the overall experience is overwhelming their body, and so their pressure has to go up. So strength is your friend when you have prolapse. There is an amazing TED Talk by Laura Vanderkam. She is a writer and she is incredible. I love her viewpoint on a lot of things, but she's talking about prioritizing and time management, and it is hilarious and it is awesome and full of great tips. So I'm going to link that, because I think that would be really good to listen to, because we often feel like we are very busy, when in reality our schedule reflects our priority, because there are so many people all over the world who seem to be able to get things done that they want to get done. And so I would check that out, because I think it is an amazing TED Talk and very inspiring for taking a look at your schedule and seeing how you can rearrange things to prioritize your goals. Now, if it's just not a priority, it's not a priority. And I love admitting that, like, hey, this is not a priority for me. And then you can just let it go a little bit, and then you don't have quite as much anxiety around all these many goals if you just decide, hey, this is not in the books for right now, and let that go. All right, so that is my take on should you get surgery or should you not get surgery. I have no idea, but hopefully those thoughts were helpful in thinking about this process, and surgery could be the best fit, could have great outcomes, could be life-changing for you. It could also be a bad idea. I don't know. All right, so hopefully that helped, and good luck with the decisions ahead. I do know that prolapse is something that we can work on, and I feel like it's an area that we should have a lot of hope in for improvement in our body, but it does take time to work. All right, thanks. Question number 4. I'm 6-week postpartum and started doing some light workouts. However, now I feel I constantly have to pee. Have I injured myself? Okay, this is a great question. All right, so even if you have injured yourself, I see the body as being incredibly resilient. The human body is amazing, okay? So I really think that even if you did do something wrong, yeah, you'll be fine, we'll fix it. Okay, so feeling the need to constantly pee is often a sign of pelvic floor tightness. Okay, so if we were to go down this kind of like worst case rabbit hole, okay? probably not anything going on with you, but if we went down the worst case rabbit hole, then you might have done a little too much, maybe had a little too much pressure down on your pelvic floor before your pelvic floor was ready, maybe created a little bit of front prolapse where the urethra can kind of bulge out a little bit, which then makes it more easily irritated, which then makes you feel like you constantly have to pee. That is worst case scenario. Okay, that can be helped, okay? You need to work on pressure management. You would need to work on pelvic floor strength once you get the irritation down, once you get the tightness down. Other things to rule out, things like UTIs, okay? If you're having any burning with that, because sometimes the UTI can make you feel like you constantly need to pee. But I often find that if it's not bacteria related and that test comes back negative, then you need to be thinking pelvic floor tightness, and you need to be thinking specifically front pelvic floor tightness and irritation. I would be extra careful too with abdominal exercises. I often see that front pelvic floor tightness and irritation go hand in hand with this new ab routine. So I would be a little bit careful with that. I've got a good article on pelvic floor tightness, so I will link that for you to give you some more reading and some more thoughts. So hopefully that give you a few ideas on what might be going wrong. And sorry to go down the worst case rabbit hole. You probably just need to inhale down a few times and then it'll be gone. But when I'm getting opinions for things, I like to have best case and worst case scenario. And even worst case scenario really isn't that bad. To then make you feel better. So you are not broken. I think you will be fine. You just need a little bit of extra work with that. All right, question number 5. I've done a lot of work on my pelvic floor and hips. Thank you for your help with that, by the way. Yay, I'm so glad that the things I put out have been helpful. There now seems to be an imbalance with my core, particularly the muscles that connect to my hips. I can feel a click when I do things like dead bugs, but only on one side. Almost seems like my SI joint on the right side. Okay, so sounds like you've got a little bit of tightness in something that is rotating your pelvis. So what I want you to do, lie on your back, place your hands on your ASIS. This is the front of those hip bones. All right, let me grab this real quick. So lie on your back. All right, so lie on your back, place your hands right here on the front of your ASIS, and feel, do they feel even? Does your pelvis feel even? Or does it feel like one kind of sits lower than the other? Does it feel like one sits higher? And then that can be a sign that your pelvis is uneven. You can also scoot all the way to the wall where you put your feet on the baseboard. And does one heel feel like it reaches the wall and one leg feel like it's longer? That can also be a sign that your pelvis is rotated. The next thing I want you to do is take your hands and place them on your waist. So you're squeezing your waist, all right? So squeeze your waist above your pelvis, below your ribs. So squeeze your waist, and I want you to feel, now I want you to kind of cough or tighten your abs up like you're getting ready to do dead bugs, okay? Like somebody's gonna punch in the stomach, just kind of tense those abs. Does one side feel like it's thicker than the other, okay? Now what I want you to do is take the side that feels thinner, and I want you to tuck your bottom under on that side, okay? So you can kind of just tuck your bottom under. So see if that then doesn't thicken it back up, and then go back to your dead bug and see if that doesn't start clicking an issue. Okay, so give that a shot and see if that doesn't help with what you're dealing with. Okay, question, and before I move on, this is why I took some notes, I've got a video on hip popping that might also be helpful because I just gave you instructions from the pelvis up, but it might be coming from the rib cage down. So take a look at that popping video. I'll link that for you as well. Okay, question number 6. When you have an athlete who enjoys high intensity exercise, running, cycling, weightlifting, and they need to change up their routines to rebuild a weakness, but the new routine doesn't do them for them psychologically, what do you recommend or any advice you have? Okay, this really hits home for me because I've been an athlete my whole life, and my identity, I was a collegiate level athlete at a very large college. I've run a marathon, I've done triathlons, I've been a sponsored kiteboarder, I rock climb at a pretty high level. My identity has, for most of my life, has been wrapped up in athletics. I was a decent high school athlete as well, going into college. And so it's hard. It's hard when our identity gets questioned. It's hard when we have to take a step back and figure out what is important in our life and what is that psychological monster that we are feeling. It is almost like a crisis of consciousness, and it is hard. So taking a really deep look at what your identity is wrapped up in. Why do you need that push? What can you do instead of that? Meditation has helped me tremendously. There has been many times in my life where I've had to take a huge step back, where I have not been able to run because of an injury, or I have not been able to do anything because of the postpartum period and having to deal with prolapse, because it is annoying and it just completely changes your life. So taking that time to figure out, okay, why is my identity so wrapped up in this? The aging process is real. And at some point, you're going to have to take a step back because something's going to happen. That's just normal life. Not all of us are Jacqueline. And so how can you find your identity with who you are outside of exercise? And then how can you feed that sympathetic, parasympathetic system? How can you get that dopamine rush from something other than running your body to that extreme level? So meditation has been incredibly helpful for me for finding more of that calming, peaceful practice that has helped feed that intense side. There's often been times in my life where I've thrown myself into work because I have needed that outlet. I have needed that stimulation and that drive, and if I can't get it physically, I'm going to find somewhere else to get it. This is often a bad idea. I am not advising that. I often get myself into situations where I'm like, what did I just commit to? And then I follow through on it because, hey, I finished that marathon, so why not? Oftentimes this is to the detriment of our stress level as well. So it's really hard. It's really hard. There's no other way around that. It's just hard. So taking a good hard look at where your motivation is coming from. Do you want to do it, or do you need to do it? Why do you need to do it? And should you need to? So these are really good questions. Brianna Battles has some really good stuff on athlete brain. I love how she uses that term. I think it's amazing. So checking out some of her stuff for that is really good, because you're not alone in this struggle. There are so many of us that are athletes, have been athletes, and have that stripped from us at some period in our life, and have made comebacks. I still get to walk in those athlete shoes now. But being able to deal with that whole process without it completely tearing ourselves apart is tough. Okay, so finding somebody to talk to, getting help, maybe seeing a counselor, journaling, they're all really good things. But just know you're not alone in this. You are not the only one struggling with this, and this is a very common struggle. And those of us that have been through it, our hearts go out to you. But dig deep and you will find those answers. All right, hopefully those Q&As were helpful today. I will try to be back next week. My husband has the kids on a walk. It's Saturday morning for me while trying to get this filmed. And so I will hopefully be back next week with another round of awesome, very different questions to be able to bring you another set of Q&A. So thank you so much for joining me today.